remember what it's like to be a patient and to be laying on the flat of your back, not knowing what's going to happen next or if you're going to be okay. So in the summer of 2002, I was a recent college graduate, and I was just sort of living here in the Methow Valley, just trying to play as much as possible and work as little as possible in the mountains. And I had a serious climbing accident while climbing Cutthroat Peak. It's a peak up in the North Cascades near here. I'm not sure what caused me to fall because I have no memory of the accident, but I tumbled about 80 to 100 feet down the mountainside, broke 3 of my 4 limbs. I also had a skull fracture and subdural hematoma. I was banged up pretty bad there on this mountain peak. I was all alone with the exception of my climbing partner, who basically did his best to sort of bandage me up and stabilize me. And then he had to, rappel and descend the peak all by himself. And because we were nearly at the summit when I fell. So he had to get down off the peak all by himself, hike out, flag down help. It took about 6 hours until an Army Black Hawk was able to winch down both some responders, EMT and a medic from Arrow Methow, as well as an Army medic. They winched down from the helicopter and scooped me up and winched me out of there, and then flew me to Harborview Medical Center in Seattle. After that amount of time spent at Harborview, I kind of joked that the better part of a year of my life was spent convalescing, and so I had a new interest in either emergency medicine or physical therapy because I had lots of exposure to both. When I moved back to the Valley, Arrow Methow was offering an EMT class, and so I signed up for it because of my own personal interest in it, but also because I wanted to kind of give back to the organization that helped rescue me. So I started out as a volunteer, EMT basic volunteer, and after about probably less than a year, I discovered that I really liked this line of work, and I started showing interest in making it a career choice. I was naturally drawn to the spirit of helping other people in their time of need, and I think, yes, it was related to my accident because my first memories of waking up in the hospital are foggy ones, but I do remember how scared and confused I was. The strongest thing I can offer my patients now is that I can offer to them my background as a patient myself, and I remember what that's like to be in that situation. There's no one person that saves a life. It's the system that saves a life. We're just sort of the point of the spear. And for like a really, really critically injured or ill person, everybody from us to the ER docs, to the surgeons, to the ER techs, to the orderlies, they all play a role in saving that life. The right place to be, if you want to be in this work, is not because you want to be a hero or because you want to be recognized. Those are the wrong motivations, and you won't last. What's important is that a willingness to want to help people out, because a lot of times people call 911 because they're having a bad day. They're having a really bad day. They're probably having the worst day of their life. And if you can help them out in any way to directly ease their pain or to ease their suffering, that is what is most important. It can be a really fun job because it's a dynamic one. It's always changing. So I can ease someone's pain and suffering on one call by being with a patient with an injured climber on the side of a mountain somewhere. I can do it that way. And then the next day, I'll be easing somebody's pain and suffering in a home because they're having some other crisis, maybe a medical condition, or crisis, and their pain and suffering might not be physical, it might be emotional. Despite my drive for more education and more knowledge, I don't ever see myself going to medical school or becoming a doctor because I don't want to work in a stationary environment. I'd rather be in the ever-changing dynamic atmosphere of EMS, of pre-hospital care. I enjoy that challenge, I relish in that challenge, and I really like bringing an advanced level of medical care to people in sometimes very remote, very austere circumstances. That's when I feel like I'm at my best at doing my job.